Hi there! Before we get started, a friendly reminder. The information discussed on this podcast is for entertainment and informational purposes only. While our guests are knowledgeable in their respective fields, your personal situation may require unique guidance. We encourage you to consult with a qualified professional for personalized advice. Now enjoy the episode. Welcome to today's episode of AndWon Should Know. Today we're delving into the world of hormones. Andrea, tell me, how are your mood swings these days?
She had to ask, right? It's a great opening. You totally caught me by surprise, but yes. I will answer that question. I don't feel the peaks to be so high nowadays and the lows to be too low where, I become like, I can't function.
Right.
Yes.
So it's petered out a little bit.
It's petered out. It's been about maybe a year and a half since I've gone into full menopause. And it's something that I've had to come to terms with.
Yeah.
As with every woman. I must admit that menopause is really nothing special. We all have to go through it.
It's true.
What is special though is what each and us experience, because we are all different.
Yes.
Yes. The biology of each and every one of us, the makeup of each and every one of us is so different that maybe what we go through as individuals is special. So I'm glad that I actually went to see an endocrinologist to actually figure out what was lacking.
Yep, that's good. Yeah, exactly. There's the saying is that goes always, don't guess, just test, isn't it?
Absolutely.
So it's good to go see the endocrinologist, get the hormones tested to see where you're at, and then you can actually learn what kind of route you're perhaps going to get to and have these preventions perhaps. Of course you can't prevent menopause. That is something we all go through. Mm-hmm. But how can we
navigate that road?
Exactly.
Yeah.
With more ease.
Yeah. So today we have a special guest, Dr. Vikram, who will be coming on shortly. And we're going to talk to him about what we need to do, what will help us, how do we deal with the certain issues that we might be facing, peri-menopause, and maybe, how we could educate the men as well to be on board with us on this. Dr. Vikram, can you tell us what your field of expertise is?
So I'm an endocrinologist. Endocrinologists are the specialty of medicine where we deal with any issues with the hormone. Mm-hmm. So hormones has to be in harmony. That's why my clinic name is Harmony. So any excess of hormone or lack of hormone can lead to any endocrine disorders. And our specialty, the endocrinologists, deal with these issues, mainly the hormone excess or the deficiency.
So Dr. Vikram, I have a story for you. Now, for the past 2 years, I have been sort of not myself. There are days where I feel I can handle things, and there are days where I'm just like, I hate to say this and admit this, but a little berserk. I go a little berserk. And I never used to be like this. So I'm so glad that we have you here today because you are the expert when it comes to endocrinology. So I think Yen, I definitely need your help, along with all our viewers up there, our listeners out there. We need to know what we need to deal with, what we need to look out for, especially when we're in our perimenopause, menopause, and after. What we need to look out for.
So I think I little bit explain about the hormones first. Hormones are very essential part of our well-being as well as natural functioning of the body. So anything with a high hormone or low hormone can give rise to many medical issues. So what is the hormone? So you must have heard of growth hormone. The growth hormone is responsible for growth. Natural. Some people who have a deficiency may have a short stature and all. So similarly, thyroid hormone is essential for many functions of the body. There are stress hormones. That's the reason when we are in a very stressful situation, when these hormone levels are very high, we can't sleep. Then there are certain hormones which are produced only during the pregnancy, which are responsible for development of the breast and producing the milk, preparing the breast. Similarly, as we all know, the insulin is a very important hormone which regulates the our glucose in the body, and a lack of insulin or resistance of insulin can give rise to diabetes. So before I touch upon what happens to those hormones during the during the perimenopause. Let's go by sequence. What happens actually? Okay, so when we are all children, the switch is off. We call it sex hormone switch. Okay, so what is puberty? So what happens? We have one hormone in hypothalamus. Hypothalamus and pituitary are the part of the brain. So these are the main regulator of the hormone glands.
So that's hypothalamus and
Pituitary
Pituitary
gland.
gland.
pituitary
Yeah,
gland.
gland.
Okay.
And actually the hormones produced by the gland are called endocrine gland. So endocrinology is a study of hormonal glands in a way.
Right.
And then lack of it or the excess of the hormone giving rise to multiple endocrine issues and diseases are the one which are managed by endocrinologists.
Okay.
So till say age of 12 to 13 in females and 14 to 16 in males, the switch is on in a way. So the hypothalamus in the brain,
Yep.
the switch is on, and suddenly there is a surge of these sex hormones, and that's where in females they start to get development of breast, then they will start having menses.
Right.
In males, it's 2-3 years after the female's age.
No wonder they always say the females mature faster than the male.
Yes, that's that's
And
true. Yeah.
In the brain as well, it's the same thing.
You see, if they have siblings, even if the sibling, the brother is older than the sister,
Yeah.
still sister will grow faster.
Ah.
However, once our sex hormones start to get released, in case of females at around 12 to 14 age,
Yeah.
what happens is our bones, which are constantly growing,
Yep.
these long bones,
Yeah.
the sex hormone fuse it. So in a way, our height get locked.
Ah.
So that's the reason after puberty we stop growing tall.
I see.
You know, so in females when they have the menses, they start stop growing
I've
in
also
terms
heard.
of their height.
I've also heard that women stop growing. I guess it makes sense because we start growing earlier and then
Yes.
we stop growing also earlier. Is there any
Yes,
truth to
because
that?
the switch, the one I told you about,
Yes.
the GnRH switch, is a little bit earlier in terms of females as compared to the
I
males,
see.
2-3 years
Okay.
earlier. Okay.
Got it.
So in females, once this switch is on, what happens is the reproductive organs start to develop, and then this pituitary gland talks to the ovaries and asks ovaries to make certain hormones. So it's like a concert, you know, going
A
on.
concert.
Oh, a concert.
Yeah. So in other words, the brain, the pituitary, talks to the ovary,
Okay.
and so
Is it singing
that's-
it too?
Yes, it has to be in harmony. It has to be in harmony.
In harmony. Look at
So the hormone has to be in harmony to have a in sync with each other. So the once so I just tell you how the menstrual cycle works in females first. So once the puberty starts, there are certain hormones called FSH and LH, follicle stimulating hormone and luteinizing hormone from the brain.
Oh, that.
They-
What?
Okay, there are few hormones from
Yes.
the brain give a signal to the ovary to produce estrogen and progesterone. So estrogen prime the uterus in a way. So the lining of the uterus start to grow, and then after 14 days of in the mid cycle, there is a release of the egg, ovum we call it, and if that get fertilized,
Yep.
the female is pregnant.
Right.
So if she's not she's not pregnant, then this cell sends a signal to the brain that okay, there is no pregnancy. Then they release another hormone called progesterone, and then after 28 days, usually the uterus will start to shed, and then that's where the menses come. And this cycle keep on going on till the age of 45 to 50. Every month the menses will come and go. So
Right.
now this is the normal menstrual cycle. So reproductive age is between the age of, like the reproduction, we call it the
Yep.
reproductive age when the females start to have menses. And now coming to the menopause, what is menopause?
Which is what's been happening.
So in a way, it's a retrospective diagnosis. Why I say so? Because stopping of menses for at least 12 months
Yeah.
Yes.
in female is defined as menopause.
So, what do women have to look out for? So that I know I'm not going crazy, then I know that
Uh,
legit there is really a process of perimenopause and menopause going on without thinking
I
I'm
have
going
my
out of
own-
my mind.
So I have my own take on it. Like,
Okay.
a lot of people blame themselves during the perimenopause or menopause state, saying
Yeah.
that, something wrong, going berserk, accepting that they have come to a stage of life where the menses is going to stop.
Right.
And some people feel this is the definition of getting old, which is not
Yeah.
true.
Yeah.
So, to begin with, I will say, first of all, make sure it's really menopause.
Yeah.
So, early menopause, usually defined as anything between 40 to 45 age, is somewhere if your menses stop, and there is no other cause that it is the reason the menses has stopped.
Right.
Then only you can call as early menopause. If menses stop before the age of 40, then it's not called early menopause. It's actually premature ovarian insufficiency, or we call premature ovarian failure.
Premature ovarian failure. Ah,
Yeah,
okay.
because
So
you're not supposed to. You're supposed to have menses
Right.
till the age of 45 to 50.
Right.
And some people, it does happen earlier. So 40 to 45 we cause early menopause. But if we stop before age of 40, then then you must see an endocrinologist to find out what is the cause, why the menses has stopped.
Right.
Okay.
Okay.
Is there any reason for that?
Right.
Yes.
And
Before the age of 40,
Yes.
it's a red flag.
Yes.
Go check, get it checked out.
If your period stops.
If your period stops, yeah.
Exactly.
Yeah.
So when the menses stop, what is the main hormonal change happens is that the estrogen level drops significantly. Okay, estrogen is like a lubricant. So the female will start feeling vaginal dryness.
Yes.
Then they will feel that there is something called as vasomotor symptoms.
Yep.
What is that exactly?
So vasomotor means vessels, something to do with the vessels.
Ah,
So what
vessel
happens
motor.
suddenly, the female will feel this hot flushing, and then suddenly they are talking to you, and then suddenly they feel like, I'm feeling extremely hot. Like so hot that you have to open the fridge and just
Oh.
relax. Some people get one.
I totally have felt
Hot flashes.
that.
Oh no.
Some
Yes.
people get only one episode per day. Some people get every
Oh,
hour.
Too many. Yes.
So it differs,
Got it.
People to people it differs. So what happens is this phenomena of vasomotor reaction makes you not sleep well.
Oh my goodness, that's
Okay.
me again.
Okay. So this. Just imagine. Forget about you are menopausal, not menopausal. Doesn't matter what you are. Just imagine I don't let you sleep for 1 month
Oh God. I
properly.
So difficult.
I'm so
Of
big
course,
on
next
sleep.
day you
I
will be
can't.
cranky. You will go berserk. Just now you mentioned.
Thank you.
Then you will. So actually, the sleep disturbance is the main cause actually of you getting irritable at things which you usually don't get
Right.
irritable.
Yes.
You know? And then there is a myth saying that some people once the estrogen level they become depressed and all. It's not true.
It's
Okay?
not
It's not true.
true.
Okay.
Okay.
It's a separate depression.
It's a separate thing.
Separate thing, and it's need to be evaluated properly. And there are many causes of some reversible depression and all. So don't mix things.
Yeah.
And then
Yes.
then
Yeah.
there are certain cultural norms. Like
Yeah.
for females, feels that this is okay. This is part of life.
Yep.
Yeah.
So even though they are suffering
Yeah.
with
Yeah.
symptoms,
Yeah.
they don't voice out.
What were the symptoms you said aside from your hot flashes that you had?
Hot flashes. My mood swings.
Mood swings.
I'm generally a very calm person, but I became quite erratic at times.
Wow.
Any little things seem to trigger me off.
Okay.
I won't say who,
Yeah.
but yes.
Okay.
Yeah, stuff like that. And
Sleep. You were also
Sleep.
sleep deprivation.
sleep deprivation. I'd be able to fall asleep, but I couldn't stay asleep. And then between 2 a.m. to 4, 5 a.m., I'd be like wide awake. Libido levels,
Out the window.
forget about it. Yeah.
Hmm.
And also, I would say very little energy. You just have so little energy that you wonder, how am I going to get through the day? But now I understand it's because I'm not getting rest at night. I'm not sleeping. And I'm
Yeah, of
getting
course.
angry and upset because
It's all
related.
part of that. Yeah, it's all related.
all related.
It's part of
So
that
it's
chasm.
getting your hormones checked is so,
So
important.
Is there anything, Dr. Vikram, that you would like, if women are experiencing this, because they will eventually when they get to, peri and then of course menopause, like, is there anything that women can do to
Okay,
decrease some of these symptoms?
So quality of life, if it's really affecting your quality of life.
Yes.
So for example, if the mood changes are so much that it's affecting your day-to-day work and it's really causing damage in your performance, then there are medications we give to of course we assess first, and then there are certain medication can be taken for a period of time to get over and tackle these issues. Some people may have underdiagnosed mental condition which they never came forward,
Right.
and then that has worsened because of low testosterone, low
Low
estrogen level
testosterone.
related low mood. As Andrea mentioned that she becoming very angry, which is not her usual, which is not usual. But
Getting crusty.
I must make sure that other people agree with you that you usually don't get angry part. This theory need to be confirmed first, that is it really true. But yes, I mean,
It's true.
so first thing first is that if it's affecting the quality of life, then of course it is important to address, because it will affect the performance, and then it's not just okay to sit with your mood problems at home. Some people may have mental issues which are not diagnosed because they are not forthcoming with it, or they feel ashamed to come forward and admit that I have mental issues. People struggle by their own. They take it as a stigma, that I have
And it
mental
gets worse during
and
menopause.
it keep on getting worse because they really can't find a help, and certain things like mental issues are like diabetes. It's like, it's not you did something, it's happened. It's and you, once you take the treatment, diabetes can be managed. Even though there is a diabetes, you can manage perfectly fine. So similarly with the mood issues also, like depression and all, there are medication which can make you this, like, can be controlled, and then you don't have to suffer. Of course, during perimenopausal, you have a habit of shunning everything down into that category of, oh, I'm getting old, I have a perimenopause, I am menopausal now. This is part and parcel of life of aging.
Yes.
I have to suffer. No, you don't have to suffer.
You
number
don't
one.
have to suffer.
No.
Now, you spoke about medication just now. Does HRT come into play during a woman's stage in her menopause?
Very good question, Andrea, because this part actually, in Asian context, right? I don't know, there is a social acceptance, I think. People don't come forward. They feel that, low libido, vaginal dryness. That's why they don't want to have sexual intercourse because painful and all.
Right.
They think it's part and parcel of aging, and then they say it's okay, I'm old now. Even for male, like they think that, they have any issues, they will shun it as, okay, I'm old now, what is there to do about it?
Yeah, actually, that is a very sad point that every man and woman has to go through, because even for me, I think, maybe I'm not doing my part as a wife, but physically I feel, because it hurts, it really hurts. There's that dryness, your libido level goes down. So as a wife, I've always thought to myself, am I not doing my part? And what can I do? Yeah. So I'm glad you actually have brought this up several times. It's hit me, obviously.
The problem with us, I think, I don't want to categorize it in a way, but I feel that Western population, my patients they are very vocal about it.
Yes,
and
absolutely.
They are very open about it. They don't feel like this thing need to be, I need to hide these things and all.
Absolutely.
They will just say that it's very painful, it's very dry, can you fix it?
Yeah, exactly.
Okay, because they think this is the quality of life is affecting,
Exactly.
And also, I think
so
to come to the realization that, I'm not alone in this.
No, you're not.
All of us women go through this.
Absolutely.
And if we are able to just share how we feel And also hope that our husbands understand. Like for me, what was really helpful with Pierre, he came to all my gynae visits with me.
That's very nice.
So he understood whenever my gynae would say, so he'd be right there in the room, seated. And if my gynae would say, wow, it's looking really dry down there, or, okay, I think I need to recommend that you put this topical cream rather than do it orally, to take it orally. So it helped the relationship a lot because then there was an understanding. But no matter what you do, you would as a wife feel that you're not doing your part.
I don't think so. You should think that way to begin with.
I need to get that out of my head.
I don't think so because I think it's a journey of life where everybody, it's like a team, right? In a way.
Effort.
And then yes, certain things can be helped.
Yeah,
sometimes, but these things can be helped.
Yeah, exactly.
That's what I'm saying. Like you don't have to.
HRT, is it?
Yeah. So as you mentioned, for vaginal dryness there are topical, non-estrogen based, and estrogen based. Okay. So touching the topic of hormone replacement therapy, right?
Yes.
So first of all, make sure that and there are few patients who should never receive hormone replacement therapy.
Okay.
You have to make sure you are not among those group of patients.
Okay.
So what are those? Okay. So if you have a breast cancer, you please consult with your gynecologist, and because certain breast cancers they have the estrogen receptor, so hormone replacement therapy is just giving the estrogen. Okay. So if you give estrogen to them, there is a chance that it may grow. Okay.
Right.
Number two is that if you have endometriosis, endometriosis means in very simplified version is that the menstruation comes only from the uterus, right? So suppose these same linings are somewhere other than the uterus, it becomes extremely painful when the menses start and all. And when you give estrogen, this condition may worsen. Okay. Third thing is that if you ever had any blood clot, unexplained blood clots, so taking hormone replacement therapy can worsen that condition. Okay. And I'm sure in 2002 you must have heard this. It was all over in the news that hormone replacement therapy has causing stroke, heart attack, cancers. Okay. So it's that study itself has a big flaw, but because they included up to age of 79, who they chose to give hormone replacement. Having said that, yes, hormone replacement therapy should be given before age of 60. And you must not give more than 3 to 5 years, depending on, you actually transit the person out without suffering in a way,
Right.
So if they are really very symptomatic, even if it's age of 45 or 42, and in certain cases premature ovarian failure, we do give hormone replacement therapy. So another myth or concept we have is that the sex hormone or hormone is only for sex, right?
Yeah.
It's not. So estrogen plays a big role in our bone health. Okay. You must have heard the condition called osteoporosis.
Yes.
Osteo means bone. Porosis means becoming porous. Okay. So if something becomes more porous, if it falls down, it will easily break.
Yes.
Right. So estrogen. So I always give this example to my patient, easy to understand. So just imagine there are construction workers who are making a road. Okay. So say 10 people supposed to dig the road.
Yep.
And then the 10 people on the other side supposed to fill up the material to rebuild the road. So 10 people are digging, 10 people are filling in. This is constantly going on our body. It's called bone remodeling. Okay. So since our birth till we die, our bone is constantly remodeling like that, and the minerals are used for other functions. Okay. So what happens, once we hit the puberty, then estrogen, even in male, testosterone, which converts to estrogen, and then this estrogen helps in building the bone. Okay.
Okay.
In the building. So our bones start to build once we hit the puberty till the age of 35 to 40. So that's the reason you see the children will break their bone very easily.
Yep.
And the elderly will break their bone easily.
Right.
But during that period, during the reproductive age, we don't see anyone developing fractures just by falling down.
Right.
Okay.
Right.
Because our bone are the strongest.
Right.
So estrogen is very important part in building the bone. So suddenly when the menopause happens and then the estrogen levels drastically goes down,
Yep.
what happens to it is that, as I told you, the people who are digging the road, that means osteoclast, who are making the bone porous, and osteoblasts are the one who are filling up the bone.
Right.
Right. So the osteoblast activity goes down. So there is unopposed action of osteoclast. So in other words, simplify, as I
Hollowing.
say, yeah, the digging the
diggers.
road, the diggers are the same. They
Right.
keep on digging, but the fillers are the one who are not
They're
functioning.
slacking.
Yeah. So
They're slacking.
slowing down. I will not say slacking.
Yeah.
But this, in effect, what happens is then, of course, the more amount of bone is taken out,
Right.
right? So this will develop osteoporosis. Once the menses stop or about to stop, when the estrogen start to go, this is slow process. So after 5 years to 10 years down the line, certain females may develop this condition called osteoporosis.
This is such a good segue because I wanted to ask you, because I've been reading a lot about weightlifting because I love lifting weights.
Yes.
And I've read recently that lifting weights does help also with the prevention or the prolonging of not getting osteoporosis. Is that true? Something about tensile muscles. Tensile strength, sorry.
So for example, I will say, before you go to say suddenly start running marathon,
Yeah.
you have to make sure that, are you good enough?
Yeah.
You suddenly
I can't run
shouldn't
a
jump,
marathon.
right?
Yeah.
So you have to gradually prepare for it, make sure you don't have any issues which need to be addressed first. Similarly, any form of exercise when you already have osteoporosis. So for example, yoga. Yoga
Yes.
seems to be so harmless, right?
Yeah.
But if you have a severe osteoporosis and your spine is porotic, very, very fragile, even certain poses you do in yoga
Yep.
can cause spinal fracture.
That's
So
true.
so I have seen patients who have fractured by doing certain pose in yoga.
Right.
Similarly, I have seen people who just lifting a heavy bag fracturing their back.
Okay.
So before addressing to your thing that can I do, but of course it's not no, because remember, if suppose I have to strengthen my bones,
Yep.
if I lift anything with my hand which has a weight
Yep.
against resistance,
Yep.
what will happen is my muscle will become very strong.
Mm.
And because the bone also has to bear the weight,
The weight. Yep.
the bones around this joint and muscles also become very strong. So easy answer, yes, weightlifting is very good.
Yes.
It's very good to strengthen your bone and muscle. Yes,
Yes.
definitely. But before jumping to this exercise, make sure, are you fit enough to lift
To do
weight?
it.
For
Do it
example,
gradually.
Yeah,
Don't
gradually.
just jump and become
and-
Hercules, right?
Yes. And
From
if
nothing.
you already have a spine problem, then you consult with a doctor. Is it okay for me to lift weight? Another thing which we think that, like a lot of female patient of mine who say, oh, I go to sunlight every day.
Oh,
I
yeah.
take dairy products. I
Ah.
take vitamin D and calcium. I do not have osteoporosis.
Yep.
These things are good. These things are very important, that you should go to sunlight, get adequate sunlight exposure,
Yeah.
because your skin is the biggest source of making vitamin D, even
Yes.
more than taking oral vitamin D actually.
Yep.
So yes, going to the sunlight. I always ask them to go to the sunlight when sun is right at, perpendicular to you,
Okay.
around 12 o'clock to 1 o'clock.
Man,
Oh.
that's like really hot.
Yeah.
That's really hot, but you don't have to spend more time. You just go for 5-10 minutes enough.
Doctor, I
Oh.
tell you, we Asian women, we spend so much money on laser treatment for our pigmentation and freckles.
Yes,
What,
melasma.
12 to 1 p.m. is a
Prime time.
Tricky for us. Tricky.
But almost 80 to 90% Singaporean people are vitamin D deficiency.
Yeah, that's
we
true.
avoid the
Very-
sun so much.
we avoid
don't we?
sun.
I'm
so
D
much.
deficient.
Yeah, no, not you, everybody.
Yeah.
It's not only
We're
you.
always
If you check,
indoors.
there is 80% chance that
Yeah.
the vitamin
Yeah.
D deficiency is there.
How is hormone replacement therapy administered?
Okay, so there are different forms. Again, depending on individual choice.
Okay.
So I will not go very technical about it, but
Yep.
if you don't have a uterus, then you don't need progesterone.
Okay.
For suppose surgically, if the uterus has been removed,
Yes.
then you may not need the progesterone part.
Okay.
Then the oral contraceptive pills
Okay.
are very high dose estrogen as compared to hormone replacement therapy. Okay, so hormone replacement therapy is
So it's an oral, like you can take oral. It
Yes.
can be administered orally.
orally. Yes.
So because I'm so pain adverse, as we spoke about in the clinic, very afraid of pain. I'm always like, oh, do I need an injection? Even taking
there are
blood, I freak out a
gel
bit.
form also.
Okay.
You can apply
Gel form.
Yes,
Ah.
apply the gel over the inner part of the thigh,
Ah.
and there are estrogen patch also.
Okay.
Just be very careful if you are applying the estrogen gel.
Yep.
If you are in contact with the male
Yes.
partner, he will absorb the estrogen.
Oh.
So make sure that you have to wash it thoroughly before you are in
Right.
touch with your partner, because
see.
then you start noticing that he's developing boobs, right? Male boobs, you call it,
Real?
right? Yeah, because
Oh my goodness.
yeah, so estrogen, high level of estrogen in male will cause gynecomastia. Gynecomastia is development of breast in males.
Right.
Okay.
And it can be so easily transferred,
Yes,
skin
yes.
to skin.
Yes, if it's you not wash, you applying the gel, because it's absorbed via skin contact.
In life, we need to debunk myths, right?
Yes. I love debunking myths because there's so many out there, and it's like, I think a lot of people, after they hear enough, they think this is truth. So I think one of my favorite myths that I've heard that I would love for you to address is soy drink, because we drink a lot of soy out in the
Love
region.
soy.
We love soy. We've heard often that drinking too much soy, consuming too much soy, will cause breast cancer. How much truth is there to that?
Okay, the simple answer is that there is no truth in it.
Exactly.
So
Oh my goodness.
I love
simple
that
thing I will tell you that is that Japanese, who are the highest Japanese population, is the highest consumption of soy happens in Japanese as compared to the Western people. So if there is a truth in it, then you should have seen a lot of breast cancer patients coming from Japan as compared to Westerners, right?
That's true.
So, however, having said that, there are many studies. We call it randomized control trial. That means you randomize certain people to soy and certain people who are not taking any soy products, right? And then there are few studies in Japanese saying that they suffer less perimenopausal symptoms because soy is estrogenic. It does have a little bit of estrogen properties, and it does work on estrogen receptors. So that's the reason the myth, because any form of estrogen, if somebody have potential of developing breast cancer, it may worsen it. So yes, there is this fear of developing breast cancer if you take too much of soy. And if you take soy, then you don't develop any form of perimenopausal symptom, right?
Right.
But
Sounds like a double-edged sword to me, though. Now I just said, "Hang
Yeah,
you
we
know."
can go and
I said,
have-
"Woohoo! We can have
But
as much as
when
soy
you
as
do
we
a
like."
randomized control trials,
Okay.
randomized control trials mean you randomize between those who are on soy and those who are not on soy.
Right, and some of these subjects would already have some pre-existing conditions.
Exactly. So study population should be even out. That means,
Right.
and then if you compare head to head, there is no difference actually.
There's
Right.
no difference.
But I think everything in moderation, right? That's usually
90 grams of soy per day is okay.
90.
90.
Grams
Okay,
per,
okay.
and then if you can easily find out which product contains how much soy actually.
What
So
about GMO, non-GMO? Does it matter?
I don't think so.
Okay.
Okay. That's good to know.
What about plastics and microplastics? Does it affect our hormones?
Actually, this is a very new topic, relatively new topic. So in medical field, right, we always have to find out causes to effect. This is how we say whether there is evidence. Evidence means yes, if you repeat it, it will happen again. First of all, what amount is microplastic? What is
Yep.
nanoplastic?
Yes.
And what is different form of plastic? Like
Yeah, you could really deep dive into that.
yes,
Yeah.
deep dive, and then, but so far there is no such established diagnosis. That means if you take plastic is directly related to some form of endocrine, cancer or endocrine disease, is yet not to be proven. But that does not necessarily mean it is not there. But I think in 2-3 years time, I think we will have more information on this, because there are a lot of studies going on this matter. Even the Teflon you use for
Yes,
cooking.
that's right. Yes, the Teflon.
Teflon,
Yeah.
non-stick versus
Yeah.
non-stick.
Plastic chopping
Yes.
boards.
Yeah, so even if you are cooking,
yeah.
you're doing some friction
Yes.
on the how much you are eroding the the
Exactly.
pan.
we don't know, how much
Exactly.
is mixed in the food. We don't know.
What about osteoporosis only affects women, not men?
Oh, this is a big myth. Okay, so the me no pause and men no pause, right?
Yes. Men, no pause. Oh my God, when you that's hilarious.
Okay.
Me, no.
So no such thing as men no pause.
Yeah.
Men
No
do
such
pause
thing.
too. Okay. Of course, it's not drastic as females. Like in females, the menses and it's visibility, right? I
Yes.
mean, if suppose female is menses is getting, there is something to objectively look for. For men, it's very difficult to objectively look for what is the sign of my testosterone going down. And so if the testosterone levels also can drastically go down, and not everybody have the same symptoms, or they are not coming forward. So at the age of 70, I will say, or 75,
70 to
70,
75, then they experience
no, I mean,
this?
the risk of osteoporosis is equal out in a way.
Oh, okay.
After age of 60 is no harm getting tested for having osteoporosis. A simple scan takes only 10 minutes, no radiation. So just a bone scan to see whether you have a osteoporosis or not.
What about the other one that I've heard a lot is green tea decreases sperm count?
So if you see, there are a lot of things. I mean, you go to Singapore, you talk about green tea.
Yeah.
You go to different part of world, there may be some local beverage
Yeah.
associated with something and all. Okay, so there is no. If it's true,
Yes.
by now, it will be recommendation already in the guidelines that you do not take. Right.
Right.
Yeah.
So, for example, in thyroid, some people say don't take broccoli because you have thyroid problem, which is not true.
Thank you, Dr. Vikram.
Thank you so much
Thank
for
you
your
very
time.
much.
I think maybe one last question would be going forward after menopause. What can women like myself, for instance, look forward to? And perhaps what can help us through this period of after menopause? Because I'm still feeling the hot flashes. My mood, I'm very proud to say, is a lot better. A lot better.
So,
I don't know about the crying part. The weepy part is still weepy. Happy weepy, sad weepy, nice weepy. Everything is just weepy for me.
but
Yes.
that's maybe some people just are, just emotional,
Yeah.
and some people are threshold is maybe different. What you should do, you should not do anything different. First of all, try to treat yourself as you are not different than men. Number one, okay.
Yes.
You
There's
take-
really
take the-
nothing special about
Yes,
menopause. We
exactly.
all go through it.
The menses stop. Okay, so
Yes.
it's a part of life. Move on. Okay.
Yes.
Same thing like females get very cautious about when they start the menses, how to talk about it in certain conservative families and all those. In India, they're not supposed to attend some spiritual gatherings if you having menses and all.
Right, I've heard that.
Yeah, so these are all nonsense, right? In a way. So similar. This is how I will tell you. The thing is what you tell yourself, right? If you want to suddenly feel very old just by menses becoming irregular or menses stop, that's why I'm old. Actually, that is in your mind, right? In a way.
Yep.
It's nothing to do with
Yes.
menses. Just
Yeah.
because menses stop, you become old suddenly.
Yeah.
Yesterday, 1 year before I was very young.
Yeah.
Menses stop, I become very old.
Oh, we love you.
Such a blocker, right? Yeah.
So this is all in the mind, right?
Yeah,
And
yes.
then
It's very mental.
people who are telling you this, you ask them to, shut up, right? Because you don't judge female by their menstrual cycle.
Yes.
Be it during that phase of just now we mentioned, right?
Can you give
Anything,
us permission to slap these people?
So yeah, I mean that's why I don't want to emphasize too much. Okay, Andrea, you should do this, you should do that.
Okay.
That means in a way I'm treating you very differently, right? You
Okay.
don't have to. If at all you also have osteoporosis, say postmenopause, so you don't. The life doesn't stop there. There are very good treatments now.
Yeah.
You reduce the risk of fracture significantly by treatment, so you don't have to deprive yourself from weightlifting
Yes.
just because someone told you that okay, you have osteoporosis, you can't. It's yes, with the medical guidance and award. So you as long as you are aware, as
Yes.
long as you are aware of it. And only thing I will say that you have to be very, 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 very cautious to blame everything on menopause. Or do not do that.
Do not.
do not do that. If you really think the symptoms are not, get opinion from doctor.
Yes.
Consult
Because
the doctor.
there could be an underlying issue.
Exactly. Another thing is that if you are on hormone replacement therapy, remember hormone replacement therapy is not oral contraception. So you have to be very careful when you are on HRT. There is a high chance you may get pregnant too. You have to be very. If you don't want to get pregnant, then you have to be very careful. Even if
Okay.
you're on HRT, you should take precaution not to get pregnant.
Ah,
Interesting. Okay.
Well, thank you so much for your time today, Dr. Vikram. It was a
Absolutely.
fantastic conversation.
Yes, thank you. If you've got any questions for him, anything you're going through that you want us to address with regards to hormones, menopause, perimenopause, just let us know.
Please also like and subscribe to our channel so you can get more information from AndWon Should Know.